Hey, my friends, how are you? All right, welcome to second quarter. And if you listened to our kickoff podcast last week with Claire, you heard us talk about a few different major topics that we're going to deep dive into a lot more over the next couple months. And one of those topics that we talked about was preparing yourself for the upcoming slower summer months. So I know when I used to work in a dental practice, we would, start creeping up on summertime when the kids are getting out of school. And then, and then, your schedule starts to fall apart all of a sudden. People are taking vacations. They're taking, time away to take time with family. And I know when I worked in my practice up in the state of Washington, sunny, beautiful days were always a rare occasion, and so whenever the sun came out, it was always that, oh my gosh, how many people were going to drop out of our schedule for today because the sun's out. People wanted to go out on their boat and go fishing or go skiing on the lakes or whatever it might be. So if you're in an area like that, you know exactly what I'm talking about. When the sun comes out, people really cancel their day and they go out and play. So I just wanted to use this podcast episode to give you 3 reports for keeping your hygiene schedule full. Okay. So this is, 3 reports that everybody should be using on a regular basis. Now, if you have been listening to my podcast for a while, or if you are part of our exclusive membership, you may already have watched our full on course on continuing care is the lifeblood of your practice. And you may already be really familiar with these reports, but maybe you're going to get a couple nuggets of knowledge, maybe a couple pearls out of this podcast that maybe you haven't heard before. And so it's definitely worth tuning into. And so the other thing I want to think about when I'm keeping my schedule full is I really want to follow up with patients, no matter if your schedule is, scheduled out 3, 4, 6 months in advance, or if you are a kind of practice that only books out maybe a couple weeks in advance. No matter how full your schedule is, you have a responsibility to check in with those patients who are overdue and not scheduled. Okay. People, they just get busy. And, a lot of times they're getting those automated messages, maybe from your automated system. Maybe you're using Patient Engage or Modento or Yappy, and patients are getting those automated text messages that, hey, you're overdue. Please call our office to schedule. But sometimes they cancel those messages or they delete those messages, they forget. And so anytime you have an automated system, it is also important that you supplement that automated system with some manual contacts to your patients, because sometimes patients just really want that personal touch. Maybe they want that personal text message, or they want you to actually pick up the phone, old school, and give them a call. So we really need to supplement the automated system with some personal communication with your patients so that we get them back on your schedule. If you don't reach out to your patients that are overdue and unscheduled, they will go to another office because they think you don't care. Or maybe they're like, I don't know if I'm still a patient there, so maybe it's been a couple years and they feel like maybe they're embarrassed to get back in. So I think it is up to you to reach back out to your patients and let them know that you are still their dentist and you still want to get them back in your schedule. Now, if you are booked out several months in advance and you're like, I don't want to call my patients because I don't have anywhere to put them. Where am I going to put them? Does this sound like you? Yeah, I know it's a bummer. And I get that. It's kind of a good problem to have, really, because, your hygiene schedule is full and you just don't have anywhere to put patients. But here's what I would recommend that you do. This is kind of the 4th report I would talk about to keep your schedule full, but the ASAP list is great for this. I was in an office yesterday and their ASAP list is the longest I've ever seen. So it's such a great resource to have a list of patients that are on your schedule, but they want to come in sooner. So just a fantastic list for that ASAP list. And so if you're booked out far and you are reaching out to patients that are overdue, then always ask them every single time, hey, I know you're scheduled out, into September. If I get anything sooner, is it okay if I call you? I'm going to put you on my VIP list. I'm going to put you on my priority list, and you're going to be the first person I call if I get an opening. Is that okay if I put you on my call list? And of course, they're probably going to say yes. And then you put them on your ASAP list. It's just such a great resource when you do have those short notice openings and you're trying to fill your schedule in short notice. Maybe you have an opening that happened, for this afternoon, or maybe somebody left a voicemail on your recorder overnight, and now you have an opening midday. That's ASAP list is the first thing that I would go to. Okay, so how do we reach out to patients who are overdue and unscheduled? Okay, well, there's 3 lists I'm going to talk to you about. The first list is your unscheduled list. Now, I know what you might be thinking. You might be thinking, oh, Dana, this list is so long, and we just stopped looking at it. We just don't even look at the unscheduled list anymore because it's so long. And it just feels so daunting and overwhelming that I don't even want to look at it. Well, good news is I would recommend purging it, so purge the list down, make it more manageable. And that way you have a really good resource for getting those patients back on your appointment book. The thing I love about the unscheduled list is that these patients have already been on your schedule. They already made a commitment to be on your schedule, and maybe they canceled for one reason or another. Maybe they were sick and they had to cancel, or maybe they missed an appointment for an emergency. You just never know why patients miss an appointment. And I always want to give them the benefit of the doubt if they do miss an appointment, because, especially if they're good patients, especially if it's somebody that you do want to keep in your practice. So the unscheduled list is my first go-to when I'm reaching out to patients that are overdue and unscheduled, because these patients have already been on your schedule. The second list is my next go-to list for keeping your hygiene schedule full is the continuing care. Now, there's 2 continuing care lists that you can tap into. And if you want to deep dive into continuing care, I have a full-on CE course in my membership that deep dives into continuing care. And I go through both of these reports in detail, show you how to run them and how to manage these 2 lists. So there's 2 lists that you can tap into for your continuing care. So when we come back, I'll tell you all about them. All right, so there is the traditional continuing care list, and it's located right on the appointment book. You can click on the continuing care icon and generate a list of patients that are overdue. This is a traditional list. It's probably been around since Dentrix was first born, so it's not a very sexy list, and it's not very interactive, but it is a very good list. It gives you everything you need to find patients that are overdue and unscheduled for their perio maintenance or their prophy. Another thing I love about the traditional list is that you can create like custom lists. So at the click of one button, you can generate a list that's customized to your preferences. I know when I was in my own practice, what I did in my practice is I created a list for my hygienist, Catherine, my hygienist, Jennifer, and my hygienist, Sarah. So I had 3 custom lists because in our practice, we did mark in the provider two field that of patients that wanted to only see Jennifer or only see Catherine, because our patients in our practice were very loyal to their hygienist. Now, that might not be the case in your practice, but if it is, you definitely could create templates for each of your hygienists, which is amazing. Now, if you just wanted to create some custom templates for just like all your pro-fee patients that are overdue by a year, it's super easy to create. You just create a custom list, and then you just one click generate a list. You get a whole list of patients that are overdue and unscheduled for their pro-fee or their perio maintenance. It works beautifully. The second list that you can also generate for continuing care is a little bit more interactive, but it's also a little bit more, takes a little bit more work to generate, but the benefits really outweigh the amount of time that it takes to generate the list. It just takes a couple extra clicks. I love the letters and custom lists on the Office Manager for generating an overdue continuing care list. I love it that way because when you open something in the List Manager, it's super interactive. You have it's just like opening up a Dentrix module because you have all the icons on the toolbar. It's just really, really snazzy. I love it. So that would be list number 2, is generating a continuing care list of patients that are overdue for just their recare. Now, the third list that I love in Dentrix is called the Treatment Manager. Now, the Treatment Manager is probably my favorite report in Dentrix. And I even have a nickname for it. So any of you that may have worked with me before, you know that I call this list a gold mine. This is called mining for gold. And the treatment manager is going to find patients that have treatment recommended, but is unscheduled. Okay. So the reason I like to use the treatment manager for hygiene is you can find patients that have had treatment plan for scaling and rib planing because you can filter that list by procedure code. So you could filter that list by scaling and rib planing codes and generate a list of patients that have had scaling and rib planing treatment planned, and they might not be scheduled. So really great way to follow up with patients for their periotherapy and make sure that they're not falling through the cracks. So I hope that you will take those tips and how to keep your schedule full and, mark these into your weekly routine. All 3 of these lists, the unscheduled list, the treatment manager, and the continuing care list should all be part of your weekly routine. Okay. And you should be making, I would say, at least, 10 to 20 patient contact calls or texts, private text messages per week off these lists. This way, you make sure that your patients are not falling through the cracks. You're following back up with them in a timely manner so they get back on your schedule. Okay. Oh, such a great way of keeping your schedule full, making sure that you have really good ASAP list for these upcoming summer months that are coming, and that patients are going to be canceling when the sun comes out. So make sure that you are prepared. Now, if you listened to my quick little ad, which was about 5 minutes ago, you probably heard that I have a short video series on your daily, weekly, monthly workflow. So if you click on the link that is in the show notes, you will also get a tip sheet that talks about these lists. So it's totally free. The only thing I'm asking you for is your email address and your name. And then you just get into my email list. Okay. I don't sell anybody's email. I don't spam you. I'm not going to sell you anything that isn't going to be relevant to you. Okay. I'm not going to send you a set of steak knives or, anything like that. Just, putting your name and email into that opt-in page, then we'll just get you into a more deeper dive video series of what we just talked about. And then if you're really ready to take it to the next level, then you're going to jump into my full-on membership. It's an exclusive membership. It's a very intimate group. We do group coaching calls every week, and you really will get the support that you need in your practice to have a successful, healthy practice. So super excited to watch you. And please let me know if you have any questions after listening to this podcast. You can comment on your favorite podcast player. Please share it, rate it, review it with your colleagues. That's really how we get our information out to more people. So I look forward to following your journey of becoming a high-performing dental team. Until next time.